So I'm going to just, because I know we're kind of short on time today, I'm going to kind of just start talking, and hopefully as I go, we're able to get the second screen up. But I just wanted to first acknowledge, again, the people who organized this event. Thanks again for inviting me. I feel very privileged to be here. And I wanted to again acknowledge that today is International Women's Day. And I'm so excited to be speaking today on International Women's Day. And I'm so excited about the panel we have organized for you this afternoon with 4 incredibly accomplished women. I think it's going to be absolutely incredible. So just to start off, I only have about a half hour total, and so what I'm going to do is speak for about 20 minutes, and then I'm hoping we can have 10 minutes of kind of open discussion or questions about kind of some of the things that I've talked about. But what I want to say is that, I'm not going to stand up here and provide any definitive answers, because social isolation, as you all know, is a very complex problem, and it has complex causes and complex outcomes, and I don't have all the answers. So what I want to do instead is to tell you about some of the kind of emerging research that's happening in the field of social isolation, kind of gerontology research that's coming out, and some of the research I'm doing and others at McMaster, and hopefully this will provide you with some things to think about as we move forward, and some things to keep in mind as we go forward this afternoon into the really amazing panel that we have planned. So, of course, when I was asked to give this talk, they said, okay, you have about a half hour, and so I promptly prepared 2.5 hours worth of content, which most academics do in these types of scenarios. So in the past week, I've been working really hard to kind of distill that down and cull it, basically because I had way too much information. As you can probably tell, I'm a bit of a nerd. I'm really interested in the well-being of older people, and I spend basically my whole life, all day, every day, studying social isolation. So I have a lot that I could talk to you about, but I don't have time to talk about it all, sadly. So what we're going to talk about, firstly, I'm just going to talk kind of very briefly about how I define social isolation, because over the years, our understanding of social isolation has changed, and definitions of social isolation have changed. And so to kind of make sure we're all on the same foot here, I'm going to just provide my own definition of social isolation, mine and my colleagues' definition, and that will just provide us with a starting point. And then I'm going to move into kind of a bit of a conversation about some of these new frontiers in social isolation research, and I'm going to talk to you about the study I'm running in Hamilton right now. And then we're going to talk about taking the eye out of social isolation. I just love that phrase. I'm not sure who came up with that phrase. I see someone getting a pat on the back over here, but I just thought that was so genius. And I had a section in my talk that I rejigged a bit to kind of fit that name, because I just love it, because social isolation is not an individual problem, it's a collective problem, and that's how we should be talking about it. And so depending on time, if I have a few minutes at the end, we're just going to talk really briefly about kind of how we can shift our responses in terms of policy and programs to better meet the needs of seniors who are isolated. So just to begin, I know the slides are looking a little wonky. I'm hoping you can read this, but the definition that I tend to work with when I talk about social isolation is this really long and wordy definition on the screen here. And it says that social isolation occurs when a person has minimal social contact with good, fulfilling social relationships. As a result, people who experience social isolation typically lack meaningful social engagement with their communities and do not feel a strong sense of belonging. So I realize that this is a very long and wordy definition. It's not something that you can just rattle off really quickly, but I do think it's important because it captures the essence of social isolation, which is that it's multidimensional and it's very complex. Okay, so again, I know it's a little wordy, but to me, this definition really captures the complexities of social isolation and how we think about it today. And so I know that everyone in here is aware of the dangers of social isolation and the negative outcomes of social isolation, but I still felt the need to put a slide up anyway, just briefly listing off some of the negative outcomes that can occur as a result of social isolation. And so again, I know this is not news to anyone, but I always like to reinforce the true perils of social isolation and why it needs to be a priority moving forward. And so in the existing literature, in a lot of the research that I've been through, we're not able to say that social isolation causes any of these things, but we can say there's a link, there's a connection. And so what we know for sure is that seniors who are socially isolated, unfortunately, have an increased risk of cognitive decline and dementia. They have an increased risk of depression, an increased risk of loneliness and low self-esteem. But also they have an increased risk of experiencing elder abuse as well. And then it trickles down, and oftentimes we see that older people who are socially isolated have an increased risk of falling and being hospitalized as a result of those falls. And then sadly, we do see that older people who are profoundly socially isolated actually don't live as long and are at a greater risk of dying prematurely. And so, this is the slide that I always reflect on when I think about the importance of attacking social isolation through research and programming, because it really can be deadly. And I don't say that lightly. And so this is just something I know this isn't news to anyone, but I just wanted to reiterate that before jumping in. And so Canada's changing. Canada's growing. The whole world is changing, right? Our population is changing. Our demographics are changing. And so as a result, social isolation is changing as well. And the very nature of social isolation is changing. And over time, it appears to be getting worse. And I use that word with caution because social isolation it's a problem that we always try to capture in terms of estimates, because we never know for sure how many seniors are isolated, right? So all we have really are estimates, and we can estimate how many seniors across Canada are isolated, and the numbers are staggering. But I never rely too heavily on numbers, because when we start to think about seniors who are really profoundly isolated, well, how do we know where they are? How do we count them? How can we estimate a true number? And so the reports that are coming out seem to suggest that the numbers are going up, but again, it's hard to know for sure. And then, of course, more and more seniors in Canada are living in cities. And this is partly because of changing migration patterns. We've got newcomers coming to Canada from different parts of the world, and a lot of them are landing in cities. And so with this, we basically have new kind of challenges facing our cities in Canada in terms of providing proper supports for seniors and reducing isolation in our cities. And kind of the urban aspect of isolation is something I'm going to talk a bit about later on, because that's kind of the focus of my research. And then, of course, more and more people are living to be 100. People are living to be 110. It's not uncommon now to know 3, 4, 5 people in your life who are over 100, right? So this is a really positive thing. Longevity is kind of a theme right now. Our entire population is getting older, and of course, as a result, this means that we have more seniors in our communities than ever before, and it means that our seniors need more support than ever before. And so this is something to keep in mind as well, because as our society gets older, the actual experience of isolation changes, and it poses new questions for how we can prevent isolation going forward. So now that we've talked a bit about what social isolation looks like in Canada, I want to talk to you about some of the new and emerging research that's happening. And I'm going to talk to you about my study in Hamilton. And so a few years ago, I was working at a hospital downtown Hamilton, and I was running a program for seniors. And a lot of the seniors that were coming in to take part in this program were very well-connected, healthy, mobile seniors. And they loved our program. They had a great time with it. But we found that as we ran the program over and over each season, it was a lot of the same people coming out to the programs over and over again. And so I started to think, okay, this is great. We're getting people out. They're loving the programs. But I know there are other seniors who would really benefit from this program. There are thousands of seniors in Hamilton. Why aren't they coming out? Why can't we find them? And so I went home and I started doing research on isolation. And I started to look into what leads to isolation and what leads people to become shut away in their apartments. And I was really surprised to find something. Many of the kind of original research studies, publications over the past 30, 40 years seem to think that you couldn't actually be isolated if you lived in a city. And in fact, many people stated outright that the two things were mutually exclusive. That if you lived in a city, by definition, you could not be isolated. And I thought, this is not true. This is not the case. And this is what kind of put a fire underneath me to start a study, to go back and do my PhD, and to look at the experiences of people living downtown Hamilton, because I knew, based on what I'd seen, that there were absolutely isolated seniors living downtown Hamilton, despite what people seem to think about isolation and where you can live. So what I'm doing now, and thankfully I feel really blessed to have received a scholarship to do this. I'm running a study now, and I've called it Alone in a Crowd, Social Isolation Among Urban Dwelling Older Women in Hamilton. And what I'm doing is I'm interviewing older women who are socially isolated, who live downtown Hamilton, to try to understand their experiences and to figure out, how is it that you live surrounded by thousands of people and yet you're very, very isolated? So at its core, it's kind of an exploratory study because we don't know a lot about urban social isolation. And so what I'm kind of setting out to do is to interview people who are in fact isolated downtown Hamilton and to figure out how that happened and what we can do to make that better. And so the study is ongoing, so I can't speak too much to the actual results yet. I can talk to you a bit about what's come up so far, but I still I'm conducting the study right now still, so I can't provide too many actual details on the full findings. But what I want to do is kind of talk to you a bit about some of the emerging patterns that have come up so far in terms of urban isolation. And it's all so significant because, like I said, for a long time, people believed you couldn't actually be isolated if you lived in a city, and I just knew that wasn't right. So because of this, it means that very, very few studies in the past have actually looked at urban isolation, so we don't know a lot about it. But what I'm seeing in my work so far are very isolated women living downtown Hamilton, and most of them live alone. Not all of them, but most of them live alone. And most of them have financial challenges of some kind. And they feel that they don't have the financial resources to access the services they need to better their health, better their social lives. And so they very much feel stuck. And many of these older women live in apartment buildings downtown Hamilton. This is very common. Not all of them, but the common theme so far are for older women, low income, living in city housing buildings downtown to eventually become isolated if they don't have family around to support them. And so they often feel that they just don't have the means of getting out. They feel very stuck, and they don't want to be isolated. And so while we know that social isolation can take many forms and potentially anyone could be socially isolated, there definitely is a pattern emerging when it comes to isolation of older women downtown Hamilton. And so all of this has raised some really important questions for me about seniors living in urban areas and how you can become isolated despite the fact that you're surrounded by people. And one of the points that has come up over and over and over again among the seniors I've been talking to is the language and cultural barriers that many of them face. And particularly when we think about newcomer seniors or seniors who speak English as a second language, language barriers and cultural barriers come up time and time again. And as I said, many of our Canadian cities are hubs for newcomer seniors. This is great for so many reasons because it means our population is becoming increasingly diverse, and this is really positive. But the problem arises when we don't have the proper services and supports for people who speak English as a second language or for people who don't speak English at all. And sadly, based on the numbers we're seeing, seniors who speak English as a second language are very much overrepresented among those who are socially isolated. So in other words, even though language minority seniors make up less than half of our senior population, they make up a really, really big portion of the seniors who are isolated. So they're overrepresented. And this is a big problem in Hamilton, but I imagine it's likely a big problem in smaller communities as well. And so when we start to think about why so many of our newcomer seniors or our language minority seniors are becoming isolated, we need to think about things like the services and resources that we're providing in our cities and in our communities. And what they're telling me is that, well, if I don't speak English very well, and you don't provide supports in my dominant language, well, I'm not going to access those supports, or they're not accessible to me. And so as a result, I don't have the supports I need. And then, of course, things are coming up like any major life events that are tied to migration, right? Many of them left family, particularly thinking about some of the newer Syrian refugees who have landed in Hamilton. Some of them are experiencing isolation now. Some of them left their families behind. They left their money behind, and they really don't feel that they're being supported in Hamilton now. And again, I'm sure this applies in many other communities as well. And so many of them don't have proper family supports either. And so the kind of key here is that often poverty goes hand in hand with some of these other challenges. And so what you end up seeing is that there's a kind of a layering effect of different risk factors. And it means that some of the seniors in our communities end up facing a much, much, much higher risk of becoming socially isolated than other seniors who are better connected in our communities. And so, thinking again about this idea of how people can become isolated despite the fact that they're surrounded by thousands of people, we need to think about some of the kind of challenges that may be faced by seniors living in urban centers. And one of the things that comes up a lot is safety. Whether that's kind of real dangers or perceived dangers, what comes up a lot is that older people living okay, well, I'll give you the thumbs up then when it's time. So then, of course, another issue that arises is the availability of services. So even if services are available, what we're seeing in Hamilton now, and again, what might be kind of an issue in other cities, is chronic problems with wait lists. And so even if lots of senior services are available and it appears to be kind of accessible, what we're seeing is that people are being referred to various services and that they actually wait for 8, 9 plus months. And at that point, many of them just feel, oh, well, there's no point. I've waited so long for this service, there's no point anymore. I've basically given up. And so that's something that we're seeing in Hamilton as well. And then, of course, a lack of language and cultural supports, and of course, poverty. Those are two kind of big issues that have been coming up as well. Okay, so what I want to do now is kind of talk about how we can reframe isolation, because again, I mentioned today that right when I started that the way I see isolation anyway is as a collective problem. It's not a personal problem, it's a collective problem, and it's something that we need to treat as a collective problem. And so this next section is kind of focused a little bit on how we can reframe the way we talk about isolation to treat it more as a collective problem and less as an individual problem. But before we can even begin to shift gears and reframe social isolation as a community problem, we need to be very aware of the language we use when we talk about isolation. So often I attend events and I read research that's coming out from different researchers, and I find that we're very quick to frame social isolation as a very personal and individual problem. People talk about isolation as though most seniors who are isolated choose to be that way, or that they have essentially isolated themselves by not getting more involved in their communities. And for the most part, this is just not true. I would argue that based on what I've seen in my research and the conversations I've had with countless seniors, that most people who are isolated do not want to be. So as we move forward, I think it's really important to be deliberate about how we speak about isolation and how we treat people who are isolated. because social isolation is not an individual problem that people create for themselves. This is a larger problem that trickles down and impacts people on a very personal level. And, we know it's a social collective problem because the negative outcomes tied to social isolation don't just exist at the level of the person, they exist at the level of the collective too. And this is something that we often leave behind when we talk about social isolation. And, as I mentioned at the beginning of my talk, we know that social isolation can really be harmful to people. It can impact your health, it can impact your mental health, and it can even lead to falls, premature mortality, as I mentioned, but it can also impact whole communities. And so what we see in the research is that as more and more seniors become isolated, societies miss out on the contributions that seniors make to their communities. And I'm not just talking about volunteering. I'm talking about social contributions, cultural contributions. And as more and more seniors become isolated, we're missing out on everything that they have to offer as individuals. And this has been disputed, but some research has argued that as more seniors become isolated, our healthcare costs are being inflated. Again, this is disputed, but the idea here is that because it impacts your health, and isolation really does make people sick, in the end, people are sicker, they're more unwell than they would be if they were well connected. And then, of course, you see this kind of weakening of social bonds across generations. Again, as more older people become isolated, we're not seeing strong connections between our younger and our older generations. And this is a larger societal problem that needs to be addressed. And so my point here is that if this were truly an individual, personal problem, we wouldn't see such large consequences at the level of the collective. So I think going forward, it's really important to remember that this is a social problem that we're talking about. It's not an individual problem that we need to be addressing at the individual level. We need to be addressing social isolation at the level of the collective. So where do we start? How do we actually go about reframing social isolation as a community problem rather than an individual problem? And, it may seem obvious, but I think it's important to remove the blame and stigma that comes with being isolated. Again, it has a lot to do with how we talk about social isolation and how we treat the people who are isolated. Particularly in the research world, again, putting my kind of academic hat on, you often hear talk about isolation solely in the context of the individual and the problems that person has and the individual risk factors that that person has. Well, those are important. We need to kind of step away from this and look at the larger societal context that are leading to so many people being isolated. In other words, looking at the common denominators here and not just looking at the individual and saying, well, you haven't called your family in a while, you've done this to yourself. That's just not appropriate. And we know that doesn't capture the essence of social isolation. And this is, again, really important when it comes to newcomer and immigrant populations of older people. And there's a reason why seniors who speak English as a second language are overrepresented among those who are socially isolated. And it's not because their English isn't as strong. It's because we don't often have the services and resources they need in language-appropriate formats. And so I think going forward, again, it's very important that we remember not to blame people for putting themselves in an isolated state because they haven't done this to themselves. This is a social problem. So what can we do about social isolation among older people, kind of at the community level? I think it's really important that we remember that we have to actually build communities that are inclusive of older people. So again, removing the emphasis on what people can do and putting the emphasis on what we can do as whole communities to reduce this problem. And again, we need to design physical spaces that are actually accessible for older people. And that's just one small piece of the puzzle, but ultimately, if you feel that your neighborhood isn't accessible to you or you don't feel safe when you leave your apartment, you're not going to go out as much. And so I think building accessible physical spaces is important as well. And then, of course, ensuring that the public services that we offer and the community services we offer actually meet the needs of the seniors in our community. So thinking about language, thinking about financial concerns, and thinking about how we can adjust the services we provide to better meet the needs of the seniors who live in our communities. You can go to the next one. So, just kind of wrapping up here, again, I didn't want to come up here and provide all the answers because I don't have the answers. And in many ways, I wanted to come here today and actually learn from all of you more than anything else. But what I will say is that if any progress is going to be made in this area, it's going to take a number of things. And I think on the page here, I have a few important bits that I really think are crucial going forward. And I know I framed social isolation as a community problem that's going to be solved at the level of the community, but I do think it's important that we see some national level leadership here in terms of agenda setting and priority setting within the federal government. Because if we have some really strong leadership at the top saying this is an important issue that needs to be dealt with, that's going to have a trickle-down effect. And so, of course, that ties into the increased funding and stable funding for the community programs that we see in our communities, because there are so many incredible programs. I can speak more to Hamilton. I'm not too familiar with Cambridge, but from the sounds of it, there are some incredible programs that are happening in Cambridge. And what we need is increased funding and stable funding to allow these programs to continue operating. And what we also need is lifelong prevention of poverty, because at the end of the day, we see poverty as being one of the number one risk factors for social isolation above all others. And this doesn't just mean supporting older people with their financial challenges. This means preventing poverty at all stages of the life course, because if we can prevent poverty at younger ages, hopefully we'll see less poverty among our older population. And then, of course, the last kind of bit is that we need better support for our newcomers and our language minorities, because right now, especially in our urban centers, cities like Hamilton, which has been a major hub for refugees in the last few years, we need better supports for them, because right now they're being left behind and many of them are becoming isolated as a result. You can skip that one. So, just to kind of end off, I just want to leave you with a few things. At the end of the day, I want to remind everyone here that yes, social isolation does exist in cities. I think that's not going to be surprising for most of you people who work in the communities or who are seniors yourselves. I'm sure you've seen social isolation in urban centers. This can't be surprising, but I feel the need to drive that home, because there are still researchers out there who believe that it's not real. So I felt the need to drive that home. And just remember that at the end of the day, the responsibility shouldn't be on individuals to get themselves out of isolation. The responsibility is on us as communities to help them out of those circumstances. So we need to continue to take the eye out of isolation, like the title of this event states. And we need to remember that it's a collective problem that warrants a collective response. Again, taking that blame and stigma away from people who are isolated. And remember that at the end of the day, prevention is key. And all of this starts with support for people who need it the most, which includes low-income seniors and language minority seniors. So ultimately, if we provide support for the people who need it the most, we can prevent social isolation from occurring. Thank you. Just want to say thank you for everyone for kind of staying involved and staying awake through all that, because we had some tech problems and whatnot. I got a little off track, but thank you anyway for staying engaged. I appreciate that.
Thank you so much, Rachel. Thank you for providing us with a new perspective, and don't go away because we have an opportunity for questions. So anyone for questions? Over there. Ian.
You mentioned that immigrants hold a disproportionate amount of isolation in the isolation of community issues. Could this be because we're failing our immigrants with our immigrant policy? If you compare Canada to Japan, where as an immigrant you must learn the language, you must become Japanese, but in Canada we're giving them the benefit of allowing them to maintain their own identity. But is this not actually, as they're getting older, becoming a detriment to those immigrants by not making them become Canadian with taking the language?
You know, it's a good question, but I think it's an interesting point you make, because we're encouraging people to come here and remain attached to their culture and their language, but then we're not providing the supports they need in their language. So it's kind of a double-edged sword. So I can't speak too much to the actual immigration policy, but I do think that if as a country we're going to tell people, yes, you can come here, and yes, we value your culture, and yes, we value your language, well, then we need to actually put actions behind our words and actually provide supports in their languages, or else, yes, we are failing them.
Another question over here.
Thank you. Yeah, I just had a question to the comment you made about breaking that stigma that it's not an individual who makes themselves isolated, but you made a comment about, and I didn't quote you, sorry, but I'm just checking on it, about the trickling down effect. So from that larger picture trickling down to the individual. And if we're trying to solve the individual, can you speak to more what that larger source that trickles down from? I might have missed it.
Sure. No, that's okay. Basically, you know, kind of what I'm alluding to here is that there are many different risk factors and many different causes for isolation, and some of those risk factors exist at the level of the individual, and some of those risk factors exist at the level of the community. Some of those are kind of societal, and some of those could be kind of at the higher level. Immigration policies, absolutely, those are going to have a trickle-down effect, but some of those could be kind of at the community level, thinking about transportation, public transportation in our cities. If we're not providing accessible transportation for our seniors, well, that's going to have a trickle-down effect and prevent people from getting where they need to go. And so it's trickling down from multiple levels here. It's not just the community, it's not just the family, but what I'm trying to kind of say here, and sadly I don't think I maybe said it clear enough, so I thank you for your question. I think the point here, though, is that basically there are kind of larger overarching factors that are impacting people's lives. And so the problem here isn't just people choosing not to leave their apartment. These are factors that are trickling down and making people feel like they can't leave their apartments for different reasons, or their houses or whatever.
Other questions? Yes? Right behind you.
This is more of a comment than a question. What I worry about is that as seniors become more tech savvy, they're going to be in their apartments more and more because they can order food online, they don't need to go out, you know?
Yep.
And it gets delivered to the superintendent.
Yep.
And so that's something that we should be looking into before it becomes a reality.
Absolutely, no, and I agree with you, and I think this actually goes for people of all ages. Technology is one of those things where we think of it as a social connector. More and more we can FaceTime our friend who lives in BC, or we can call our daughter who lives in Europe, but what it ultimately means is that we're having less actual face-to-face interaction, and more of that interaction is happening either through the computer or through the iPad. So I do think that's an important point that you raise, and something we're going to have to address going forward.
I'll get you to read it.
Okay, so there's a question here. In your research to date, what is the approx percentage of seniors who are socially isolated with all these stigmas? Language deficit, poverty, mobility challenges. These individuals need multi-resources, and are they available? So, I mean, good question. And for the most part, I do qualitative research. So I talk to people, I interview them, I hear their stories. So a lot of what I do doesn't involve actually kind of stats or anything like that. In terms of kind of estimating, I would say at least half of them would tick most of these boxes. And again, thinking about the kind of multiple resources they may need, yeah, most of the resources they need are available, not so much language, but other kind of resources are available. But again, then we get into problems with wait lists, affordability, that kind of thing. So just because the resources are available doesn't mean that they're accessible, and doesn't mean they are accessing those.
We have one over here. He's been trying to go.
Thank you for your presentation. And when I was mentioning about what the government has done, absolutely we need to do more for seniors. And I was wondering if your research has looked at, I know most of your research is in Hamilton, but have you looked at the European countries, and in Germany and in Netherlands. For example, when I went to the Netherlands, I spoke to seniors there, and they had a certain program there that would gather a group of seniors, and they would take them on certain trips, and it would be a lot of social events, whether it's one time per week or once every other week, or etc. And for example, if we look at the median age of Canadians, it's around 41, 42 within Canada, so it's a very high number. Within Germany, it's 46, so they have one of the highest rates of seniors. Has those two countries, have you looked at any of those or any other countries around the world, and what can we learn from them? And if you can provide feedback to me, I would love to, take that information forward. Thank you.
Yeah. No, it's a great question, and sadly I haven't done too much of that kind of international comparison, so I can't speak directly to any of the the countries that you mentioned, because most of my work has been contextualized locally. I've looked across Canada, but what I can say kind of generally is that kind of on the international level, we don't do a great job here in Canada creating communities that are supportive of older people, and so again, I can't speak to any of these specific countries you mentioned, but kind of on a whole, we have a lot to learn from different countries, particularly parts of Europe and Asia that do a very good job supporting their older people. And now you're seeing a lot of kind of creative, emerging forms of housing, intergenerational housing, that kind of thing, which are really allowing older people to thrive. And that's just something we haven't done as much here in Canada. So again, can't really provide you with specifics. I'd be happy to chat after as well if you're interested. But what I would say is that we have a long way to go, and there definitely are some other countries that we could look to for guidance.
Two people asked the same question.
Okay. So 2 different people asked, how are you finding your clients for your study? And so in Hamilton, we have an amazing network of people that are all connected through kind of seniors. We have a whole network of senior centers, but I've been basically reaching out to senior centers in Hamilton, but I've also been reaching out to churches and cultural centers, and I've had a number of referrals from all of those groups, but many of the people I've ended up finding have been through city housing. And so many of them actually live in city housing buildings downtown Hamilton. And most of the city housing buildings in Hamilton are very multicultural. Many of them are low income, but that is where I've gotten most of the referrals for my study.
Okay, this is about seniors as assets.
Okay. Oh, okay. You mentioned that seniors have resources to give to society. Currently, seniors are seen as a liability in community, I think that says. I wonder if asset-based community development might change this perspective, I think that says. How do you think this might impact isolation? Yeah, so I'm not sure exactly what the term kind of asset-based community develop refers to. I'm not maybe familiar with that term as much, but I do think we need to reframe how we look at the contributions of older people, because older people are not a liability at all. They're not a liability any more than any other age group is a liability, and we need to kind of change that, and that has to do kind of culturally with how we treat older people and how we support or don't support older people, and Canada kind of on the whole is considered pretty youth oriented, right? And a lot of the attitudes we hold as a society favor younger people over older people, and that is something that needs to change, because like I said, seniors, and here I'm preaching to the choir here, but older people contribute so much to our communities, and it's not just through volunteering, right? It's through life histories, it's through social, cultural contributions, right? And so, yeah, I can't speak to that exact term, but I think shifting kind of how we even look at aging in general, and moving away from seeing aging as a bad thing and seeing aging as a good thing, and something that happens to everyone, will help to kind of reframe how we value the contributions of our older citizens.
Thank you. One more question.
Research with the individuals that you talked to that after being self-reflective about their own isolation, that perhaps they find ways to decrease their isolation after talking with you about it, and or also Are you looking at a next study to understand interventions that might help people decrease isolation in a quick turnaround time?
So in the people I've talked to, yeah, a lot of them find it's less that they say, oh, you know what, I know what I can do now to kind of reduce my isolation. A lot of it is around, well, I think I know what I want to do to reduce my isolation, but I feel like I can't do it. That's more the language that comes up, rather than, oh, you know what, I think I have at least a small answer or a small solution to try to get more connected. What I'm often hearing is, oh yeah, well, here's all the things I want to be doing or I wish I could do, but I feel like I can't do them because of money, because of transportation, because I don't have the people to help me get there, or, you know, X, Y, and Z. So that's more what comes up. And actually, I think people are pretty intuitive. People are pretty self-reflective. And as you talk to them, yeah, they say, you know, I don't want to be this way. I used to go to church every week. I used to, I used to go curling every week, that kind of thing. And I don't do any of those things anymore because of all these reasons. So people know what they want to do. They know how they can potentially improve their situations, but they feel like they can't. And the thing that comes up the most is people feeling stuck for one reason or another. And so just to speak to your second question, I'm just working on my PhD now, and this is kind of the basis for my PhD. So I personally don't have a second study planned, but I know there are some other studies going on in the area. I know some of the other New Horizons grants actually have research components built into them that will be kind of looking at interventions and the efficacy of those interventions. And so I won't personally be doing those, but there are definitely studies that are up and coming in the area that I could speak to you after about if you're interested.
Please thank Rachel for her presentation. I was handed a question for Rachel, but actually it pertains to the project that we're winding up. And the project we started in Cambridge was geared to developing peer mentors, training peer mentors to befriend older adults who are living in less happy circumstances and would benefit from having a peer mentor. The question I was given was asking, I am isolated insofar as I have no family connections and my friends are aging, and I would be interested in a volunteer friendship program. And that's exactly what the Seniors as Peer Mentors and Leaders program was designed to do. So I'm really happy to advise that we've been able to hand that program off to our friends at Community Justice Initiatives. And so the program will continue. I'm so excited by the discussions we've had so far. I think it's amazing. But I need to speak about the planning that went into today. I know Jason hasn't slept for 2 days, and I was awake at 3. We all wish these events happened by magic, but they do not. So I want to acknowledge the committee that put this event together, and I want Jason to come on up here, please. Linda, come on up here. Wendy, come on up here. June, come on up here. Leah. Yeah. Barry, where are you hiding, Barry? Barry, did you run away? No. Where did June go to? I'm here. Okay. This group represents our partnership with Housing Cambridge, that would be Barry. With Community Support Connections, that would be Leah and Linda. With Community Justice Initiatives, that's our friend Wendy. With the Cambridge Self-Help Food Bank, that's our friend June. And with Social Planning Council, which has been the backbone organization to this event and to the project. And thank you all for all that you've done to make this happen.